expired. Gentleman from Oregon, Mr. Walden.
Thank you very much, Mr. Chairman. Governor, Secretary, we're delighted to have you before the committee. You and I both know how important this issue is to all Americans, that we get it right. So I hope you can appreciate we're trying to understand what we missed along the way. And one of the things that bothered me was the letter that was sent from your agency to the GAO back in June 6th. And I'll read in part. It said, we're in the final stages of finalizing and testing the IT infrastructure that will support the application and enrollment process. HHS is extremely confident that on October 1, the marketplace will open on schedule and millions of Americans will have access to affordable quality health insurance. I'm just an average guy from a small town in Oregon, but when I read that, it tells me you believed everything was good to go, the testing was in place, and we should have full confidence everything would work, correct?
That's the letter I signed, yes, sir.
Yeah, actually it was signed by your assistant,
yes.
But
yes.
The same point. And so I went into this believing in your response, your agency's response to GAO, things were ready to go. We should have full confidence, because when somebody uses the word extremely confident, it tells me you're extremely confident. Second piece, then when we had the testimony from the witnesses last week, I asked them about the end-to-end testing and what the industry standard would be, and they said it really should have been months, especially for a project of this magnitude, and yet we heard it was only 2 weeks. Now, in August, GCI told CMS in their report,
CGI.
I'm sorry, CGI, thank you, that on August 9th that there was not enough time in the schedule to conduct adequate performance testing. Did that make its way all the way to you? And do you think there was adequate time?
Sir, clearly, as I've said before, we did not adequately do end-to-end testing. The products were not locked and loaded into the system until the third week in September. Each of the component parts was tested, validated, independently validated.
And so all of those, I'm sorry, all of those work though, right? They told us last week that their individual modules were tested and met specification. Do you concur with that analysis?
I do concur with the testing that was done, yes.
Okay, so it really was the end-to-end, which is why some of us thought to delay until it could be done right to avoid this very collapse that now is upon us. And I realize not everybody agreed with that. The second piece here gets back to the Washington Post, which I realize you haven't had, and I understand, a chance to read this morning, but the 4 Pinocchios about the president repeatedly saying, if you have a plan, you'll keep a plan. We all heard that to mean, I've got a plan with a company, I'll continue to have it even if they make minor changes, when in fact your own rules as written said, no, that really isn't what's going to happen. If minor changes are made, that means the plan changed, that means you don't get it.
Well, sir, that isn't true. The rules did not say what you just suggested, and I think the estimate given that there would be turnover in the market was really an outside projection. It wasn't our rules. It was a snapshot of what happens in the market, that plans change so dramatically over time that the estimate was they wouldn't be, not because of our rules, but because of insurance companies' business decisions.
Well, but you set up what those market rules looked like they had to comply with, correct?
Only if they chose not to grandfather the policy. That's the start.
But that meant they couldn't make any
grandfathered policy stayed in place still would be in place.
Right, but if
none of these rules apply.
But if they made any change.
No, they could make changes in pricing. They could make changes in benefits. They couldn't dramatically disadvantage the consumer, but they could have trend lines. They had a wide corridor to make sure that a similar plan. So if a consumer liked the plan, if it stayed.
So here's what the practical implication. I've got letters from constituents all over my district who have gotten letters from their insurers who say because of Obamacare, they're no longer going to be in the individual market, or at least with that plan in the individual market. And the result is this person from Cove, Oregon said I was paying $600 a month for a $3,000 deductible. Now it'll cost me $800 a month. $1 deductible. I've got others here I'll put in the record. A woman whose job she had 40 hours, now down to 29, neither has health insurance nor enough income to live on her own because of the way this law is getting implemented. I realize my time's expired.
Gentlelady from